Hi guys, my name is Dylan, and today I'm going to be taking you through my Streamlit app that I created for my BetterMinds project. And so here we go. This is a AI clinical trajectory alert thing. So basically, what happens is the patient comes in and they have some sort of complication. This model detects sepsis. So we have some synthetic data and some vitals that are pulled from, generated patients. And so here are the vitals, here are their labs. So these labs are taken, sparsely. So they're not taken all the time in the real world. So this reflects that. And it makes predictions based off of that. Now, this is where you'll see the prediction percentage. So the risk of sepsis is 97% in this patient. Down here, you can see that this is when they will start deteriorating. So their organs will start failing, right? And so the goal here is to get the AI to predict that a person has sepsis and notify the doctor before this point. And so as you can see right here, it's done that very well. It did that 160 minutes before the true onset, which is around 2.5 hours before. So that's lots of time. Here's the model benchmark tab. So you have kind of your baselines. So this is what doctors use without AI to predict things like this. And so you can see right here, all the other statistics are kind of unimportant. This one is important right here. You can see the 57-minute is, the average of how early a doctor can predict sepsis using this method, News2, which is pretty common. So, and then you can see how my model has predicted it much earlier than the typical in the world of doctors. So right here, you have all of the patients that are generated. Most of them are stable, and then these are the ones with sepsis. So you can kind of scroll through whichever ones have sepsis. You can scroll through that. And then the last thing I'll probably talk about here is right here you have kind of the drugs on board. So that kind of means what the doctors are giving them. So let's say the doctors have them on vasopressors, which would support their blood pressure because in sepsis, the blood pressure drops. So, you can see that that helps the model kind of predict that or use that to predict, because even if the blood pressure is still up, it shouldn't be because they're on vasopressors. And then right here, you kind of have like what the model is thinking. So there's two models. There's a random forest and a transformer model. And so right here, you can kind of see what the random forest model is thinking. So it went off of here, the lactate, the creatinine, and the white blood cell count, which is pretty typical for sepsis, detecting sepsis. And yeah, so that's my app. And I will see you guys in the next one.